Good evening from Toronto, Canada. My name is Dr. Gary Glassman, and I'm an endodontist in private practice in Toronto, Canada. I'm on staff at the University of Toronto, Faculty of Dentistry, and Professor of Dentistry and Director of Endodontics at the newly formed dental school at the University of Technology in Kingston, Jamaica. For the next hour, I'm going to present to you the latest innovation in nickel titanium rotary instrumentation. This is the first of 3 webinars designed to bring you the latest and greatest in endodontic technique and technology to provide your patients with the highest quality of care possible. Although this webinar covers products that are offered only by Axis Cybron Endo, this webinar has been approved for CEU because it addresses a unique technology and an endodontic technique that's not offered from any other manufacturer. So throughout this webinar, I'll be showing Axis Cybron products in order to demonstrate the clinical applications and benefits of this completely unique technology, referred to as adaptive motion technology. Although I'm not being compensated to present this webinar, I do get paid an honorarium when I present hands-on programs all around the world for Axis Cybron Endo. And everything I teach today, I use and practice myself. I want to welcome those dentists that represent the 58 countries that have logged on to tonight's webinar. And a special welcome to my friends who have logged on from Roots Facebook group. And a very, very special welcome to my friends from Endolatinos and Endodonticos. Hola, mi amigos. Just so you know, I'll be answering questions at the end of the presentation. So enter them online, and I'll answer them as they come in for the last 10 to 15 minutes of the hour. TF Adaptive is a system. It's a system that includes the tried and true twisted file design and metallurgy, combined with adaptive motion technology, providing a predictable way for the clinician to finally take control of nickel titanium files and shape the root canal with accuracy and surgical precision. Let's be clear. The color scheme of the file system is not ISO standard. It's a new paradigm that has evolved into simplicity and rational thought. It's intuitive and it's easy to understand. It's based on a traffic signal. The first file to be used in sequence is green, the second yellow, and if necessary, a third being red. Green means go, yellow means continue or stop, and red means stop. It's genius. Simplicity is the antidote to complexity. You know, when we look at the performance of nickel titanium files, we look at 3 things. We look at file design, we look at metallurgy, or how that file is manufactured and what kind of alloy it's manufactured from, and how that file is used. Does it rotate? Does it reciprocate? The twisted file is triangular in cross-section. It's a smaller surface area than a square or a rectangular cross-section, which allows for greater flexibility. It also has a safe end to tip, and what this does, it allows for that file to be self-centered safely in the root canal space. Now let's talk about the way the file moves. Let's talk about kinematics. Kinematics is the branch of mechanics concerned with the motion of objects. There are 2 motions that nickel titanium files can take: full rotary and reciprocation. There's advantages and disadvantages to both. The advantage of rotary are that it channels debris out coronally, but the disadvantages are that torsional stress and cyclic fatigue are increased. The advantage of reciprocation is clear. Increased resistance of the NiTi instrument to cyclic fatigue. But the disadvantage is equally clear, in that it pushes debris apically, which may increase postoperative discomfort and adverse postoperative sequelae. So wouldn't it be great if we had a motor for the nickel titanium instrument to provide rotary when you want it and reciprocation when you need it? Well, we have that motor, and that motor is called the Elements motor. I can count on one hand why this motor is great. It has multiple presets. It has preset for TF adaptive, a preset for rotary TF, light speed if you choose, K3 and K3XF, and even a custom setting so you can key in your own preference for speed of rotation and auto reverse sensitivity levels for the NiTi system that you currently use. It also has a setting for the M4 reciprocating handpiece. The M4 reciprocating handpiece is a handpiece that's not unique for Axis Cybron Endo, but is provided by other companies as well, to be used with the stainless steel files to facilitate the creation of a glide path. You can get the M4 handpiece from any of the dealers that you deal with today. No matter what NiTi system you use, you must create a glide path. Nickel titanium files require a pathway for which to follow. And the TF adaptive technique requires that a glide path be created to a number 15 hand file to the apical terminus. Now you can do this with your fingers, and for many of you who do root canal all day long, get around those curves, go around those calcified canals, you know how fatiguing it can be. Or you can use the M4 reciprocating handpiece. It's especially useful for establishing a glide path in calcified canals, establishing a glide path around ledges and sharp curvatures, and establishing a glide path around separated instruments. You simply select the M4 handpiece setting, feed the file into place with your fingers, because you have really little tactile feel when you use the M4 handpiece if you place the file into the handpiece alone. Once you engage or bypass the ledge, get around the curvature, or get around that separated instrument, engage the handpiece over the stainless steel file handle, hit the foot pedal, and you are on your way. The TF adaptive setting is the most useful and innovating setting of all. The Elements motor has a continuous feedback loop that self-adjusts to intracanal torsional stresses. It's amazing. There's nothing like it on the market. So when there's no load on the file, or very minimal load on the file, it rotates fully. It's an interrupted rotation, but this interrupted rotation prevents the suck down that often occurs with rotary NiTi instruments. So now you finally have control over the file rather than the file having control over you. When the file engages dentin and load is applied, then it goes into reciprocation mode and the file reciprocates 370 degrees clockwise, and depending on the load, 20 to 50 degrees counterclockwise. Well, what's good about adaptive motion technology? Rotary when you want it, reciprocation when you need it. It increases the resistance to cyclic fatigue. Better file control. You don't get that nasty suck down. Significantly less debris extrusion, which translates into less post-operative pain. The original canal curvature is maintained, and the root canal is cut more efficiently and uniform along its entire length. So let's look now at the metallurgy. of the tried and true TF files. Ground files are lathe cut against their natural grain structure, which makes them inherently weak. Microfractures occur on the surface, which, like a crack in a windshield of a car, can propagate to the center and incite instrument fracture. So to remove the microfractures, manufacturers polish the file surface, which can detrimentally affect the cutting edges and affect the surface hardness of the individual file. Nickel titanium files exist at rest in what's called the austenite crystalline phase. Files have an elastic range in which the file will return via restoring force back to its original shape. At the outer limit of this range, the file will undergo permanent deformation, which is known as the plastic range. The outer limit of the plastic range is the yield point, and the yield point is the point at which the file will break. It's the point at which that file will fail. And this is the most undesirable thing about nickel titanium files, and definitely the most endodontic nightmare that we want to avoid completely. Well, twisted files are manufactured completely different from ground files. The nickel titanium triangular blank is heat treated in salt baths using a proprietary method for a specific time and a specific heat. The alloy changes from the austenite crystalline phase into what's called the rhombohedral phase, or the R phase, what I like to call the rubberized phase. So now we have a limp piece of nickel titanium. That nickel titanium is put in the machinery, it's twisted, and then the heating and cooling process is reversed to regain the superelasticity properties of the nickel titanium file. It goes back into the austenite crystalline phase with just a little R phase left behind. So the file is twisted to maintain the natural grain structure and not ground. No microfractures occur because it's twisted and not ground, so therefore you don't need to electropolish it. And if you don't need to electropolish it, so they maintain their cutting edges and surface hardness. Not only is the elastic range wider for twisted files, which accounts for their increased flexibility when you compare it to ground files, but the plastic range is also wider and broader, so they resist fracture better than any file systems available. If we take a look at these two files, on the top, you can see one's overwound and one's fatigued. And the one on the bottom, too much pressure was placed on that file. So TF stands for twisted file, but TF also stands for teaching file. Where it overengages is shown very easily by the untwist marks. But the fact that we can have this plastic deformation and a wide, broader plastic range, we have a warning before it hits that yield point. Sure, if you abuse any file system, you can deform it and you can break it. It's like driving a nice car. You got to know how to drive it up the hills. You got to know how to drive it around the curves. It's the same thing with nickel titanium files. And the TF file resists fracture. The TF files have an increased flexibility compared to ground files. Take a look at this beautiful case done by my good friend Sergio Rossler from Buenos Aires. Look at this obtuse angle. He created a glide path perfectly. Used the M4 handpiece to create that flowing curve. And then with his TF files, he followed that glide path with surgical precision. So with any nickel titanium file system, there's certain guidelines that you have to look at. First of all, start off with simple cases. Walk before you run. Don't start off with that 90-degree curvature and do Glassman said I can do any case. Because you know what? We don't want you to end up with a nickel titanium implant. And remember, 3 primary concepts. With any nickel titanium system, create a glide path. Apply no more pressure than that which would break a sharp lead pencil, and limit the amount of time in the root canal. You're in, you're out. You engage, you remove the file, you wipe off the debris, and then you reinsert it. A glide path is so important. With the TF system and the TF adaptive, we want to create that glide path with an 08 hand file, a 10 hand file, and then a 15 hand file to the apical terminus. We can do this with our fingers, or we can do it with the M4 reciprocating handpiece. And it's great because all you got to do is select that M4 handpiece setting and you're ready to go. Patency is so important with any nickel titanium system because patency will prevent the accumulation of dentin debris at the apical area, to prevent yourself from losing your reference point, to prevent yourself from deflecting off the main canal pathway. In fact, Dr. Arias out of Spain has found in her research that when you establish and maintain apical patency, post-operative pain in necrotic non-vital teeth is statistically significantly less than if you don't maintain patency. And in vital teeth, there was no difference. So maintaining and establishing patency is so important in any technique that you do. So let's take a look at the TF adaptive. TF adaptive motion technology are the old tried and true TF file design and metallurgy with a new reciprocating handpiece. Adaptive movement adjusts based on file load. Select the TF adaptive. It's a continuous feedback loop. Understand that the file will self-adjust to intracanal torsional stresses. When there's minimal or no load applied to that file, it'll do a full interrupted rotation, preventing that suck down. When there's load on the file and it engages in dentin, then you get the reciprocation mode. You don't have to think about it. It's a no-brainer. The continuous feedback loop does it for you. Rotary when you want it, channel out that debris. Reciprocation when you need it. Increase resistance to cyclic fatigue. Now, there's lots of science behind this, and I'll be happy to email any one of you all the literature that I show and more. Just request it at my email, gary@rootcanals.ca. I don't want to belabor the point, but there is lots of science showing that the TF and TF adapter is a stronger file. Increased cyclic fatigue resistance. When you compare adaptive motion, when you compare TF file with other ground cut files, it's important that we know it's tried and tested. Less debris extrusion. Less debris extrusion means less post-operative pain. In fact, when you have less debris extrusion, we know that that patient is going to feel okay at the end of that appointment when the anesthesia wears off. We want to maintain the original canal anatomy, and the science shows that the TF adaptive does just that. Less risk of over-instrumentation and transportation. It maintains the original canal curvature. It's more efficient and cuts along the root canal wall more uniformly. So, let's take a look at the TF adaptive. You've got 3 colors: green, yellow, and red. There are 2 adaptive sequences available. There's a small sequence, which is denoted by single color bands. And there's the medium, large, which is denoted by 2 color bands. Let's take a look for a minute at the small, for those tiny small canals. The SM1, which is the green, is an 04 taper with a 20 tip size. It's a beautiful pathfinder that takes control after you engage down to the working length with a number 15 hand file. The The SM2 is an 06 taper with a 25 tip size. This is beautiful to create the taper in the root canal preparation. And the SM3, the red, is an 04 taper with a 35 tip size, ideal for apical enlargement. And the medium large, the ML1 and the ML2 are probably the two files you're going to use most in practice. The ML1 is an 08 taper with a 25 tip size, beautiful for creating the taper of the preparation. We do small bites, incremental removal from crown down. And once we reach the apical terminus, then we often can finish off with the 0635, which is the ML2, denoted by the double-colored yellow bands. And in a palatal root of an upper molar or the distal root of a lower molar where the ML2 doesn't engage, doesn't meet any resistance, then the ML3 kicks in. It's an 04 taper with a 50 tip size. They're available in 23 and 27 millimeter lengths. So let's take a look at the technique for a moment. How do we determine which sequence do we use? Do we use the small or do we use the medium large? Well, it's real simple. If you struggle to get a 15K file to working length, then the canal is deemed small. You pick up a small sequence pack. If a number 15K file is loose, then the canal size is a medium large. Very simple. The number 15 file is known to me as the determinator. The determinator. If it fits loose at working length, medium large is the one to use. But you know what? In certain situations, use the M4 handpiece, you can get a 15 to fit loose at working length. Very nice to use. So let's take a look at the actual technique. We're going to divide our root canal preparation into canal taper and then apical enlargement. Let's look at canal taper using our TF adaptive files. We're going to incrementally remove tooth structure, dentin, tissue, bacteria from the crown down to the working length. We're going to remove canal contents before we even have an opportunity to push them through the apex. And what about apical enlargement? Well, you know what? This is probably one of the largest sources of controversy in endodontics today. Do we apically enlarge or do we not apically enlarge? Not only apical enlargement at the terminus, but how about deep preparation in the apical 1/3? Well, the science is clear. Canals instrumented to larger apical sizes allow for more irrigant to be placed closer to the apex. And the closer to the irrigant to the apex, the better a canal can be cleaned. The better the ability of our sodium hypochlorite to dissolve organic tissue. The greater the ability for sodium hypochlorite, EDTA solutions, to remove the smear layer. And opening it up to a size 35 will allow us the opportunity to use the endovac, which relies on apical negative pressure. It's a way to deliver full-strength sodium hypochlorite safely to the apical terminus in abundant volumes and abundant quantities in order to dissolve the tissue and decrease the microbial contamination as best as we possibly can. Larger apical sizes remove more bacteria than small apical instrumentation, and debris is more effectively removed when the apical preparation is larger compared with smaller apical preparations. And I'm not just talking about enlargement at the apical terminus. I'm talking about enlargement of the whole apical 1/3, getting a nice deeper shape. It's really nice. So let's take a look, for example. If we follow the ML1 with the ML2, two working length, where the two intersect is at the 5 millimeter level from the apical terminus. The ML2 is an 06 taper. It fits through the 08 taper preparation created by the ML1, starts to engage at the 5 millimeter level, small surface area of contact, very efficient, very safe. Apical 1/3 enlargement. Fantastic. Now, what's the file motion? Very simple. Make sure that the file is moving and you hit the foot pedal before you place it into the canal. You place it in, and with one fluid motion, you take it out. Very simple. Wipe off the debris. Go back in again. You're in, you're out. We want to take small bites. That's the key. You're in, and then in one fluid motion, you are out again. Fantastic. Easy to use. Wipe off the debris. Make sure you've got plenty of irrigant inside the pulp chamber. Make sure you lubricate your files with a viscous chelator. Wipe off the debris. Maintain patency throughout. This is key. So, let's take you through the entire TF adaptive sequence, step by step. Remember, it's very intuitive. Just like a traffic light, it's universally accepted. The color code is easy, and it's easy for your assistants to set up. Happy assistant, happy dentist. We all know that when we walk in on Monday morning. We want a happy assistant that can set up our files easily without any hassle. When there's no load or minimal load on the file, it's a full rotation. It's an interrupted rotation, preventing suck down, but it's a full rotation which channels debris out coronally. When the file engages dentin and load is applied, then it goes into the reciprocation mode. It self-adjusts. You don't have to think about it. It's a no-brainer. If a 15 file struggles to get to working length, pick up a small pack. If the 15 file fits loose at working length, pick up a medium, large pack. Remember the basic tenets of endo. Straight line access. We'd like to create a Class 1 inlay preparation. Use your DG16 Endodontic Explorer. Find those canals. Fill up the pulp chamber, brimful, with full-strength sodium hypochlorite, and coat your files with a viscous chelator like Slick Gel or RC Prep. Establish that glide path using the 8, 10, 15 file to working length. Remember, you can do this using your fingers, or you can facilitate this by using the M4 handpiece. Simply select the setting for M4 handpiece, hit the foot pedal, and you're ready to go. Remember, small canals, if a 15 file struggles to get to working length, then pick up a small. If the 15 file fits loose at working length, pick up a medium large pack. Use a contemporary apex locator, one that accurately gets down to the working length. Use a combination of radiographs to assist in length determination as well. Select the setting for TF adaptive on your Elements motor. Flood the pulp chamber with sodium hypochlorite. Remember, this is key. The file should be rotating as you enter the canal. Slowly advance the green file, whether it be the SM1 or the ML1, in a single controlled motion until the file engages dentin. Withdraw it, wipe off the debris. Reinsert that file. Wipe off the debris from the flutes before you reinsert it. And in very tight canals, roots that have very dense dentin, sometimes you have to go 3 passes or even 4 passes. Sometimes only 2 passes. But remember, whatever system you use, make sure you establish and maintain apical patency with something as innocuous as a number 10 K file. Once we finish with the green, slowly advance the yellow file until it engages dentin, then completely withdraw the file from the canal. It's important, do not force apically, and it's important, do not peck. You place it into the tooth. Once it engages dentin to the root, you withdraw it, wipe off the debris, and reinsert it. Always establish, and maintain apical patency. And the last file, should you decide you want to use this, is the red file. Green means go, yellow means continue or stop, and red means stop. And advance this red file, the SM3 or the ML3, with a single motion that's controlled until the file reaches the working length. Deliver the irrigant to the pulp chamber, confirm apical patency once again, because you can never confirm it enough, or too much, or deliver fresh sodium hypochlorite too much to the pulp chamber. Now, when irrigating with the endovac in small canals, because the cannula, the micro cannula, is 0.32 millimeters, you must take the SM3 to working length. And in medium large canals, you must take it to an ML2. That's the technique. Simple as can be. And simple is what we want. You know, if you want a single file system and you're bent on that, the ML1 may fit that. The ML1 is an 08 taper, 25 tip size. But if you believe in apical enlargement, then a two-file system may be better, where you take the ML1 to create the taper and the ML2 to create the apical enlargement. Well, what if that ML2 fits loose at the working length? Palatal root of an upper molar, distal root of a lower molar. Well, let's go to the ML3. It's an 04 taper with a 0.50 tip size. Small surface area of engagement, beautiful for those canals that I just mentioned. Now, the TF Adaptive is packaged in individual packs of 4 files of the same file type. You can get them in 23 millimeter lengths or 27 millimeter lengths. I believe in decreased inventory. Rather than having a 21, 25, 30 millimeter lengths, the 23 and the 27 will satisfy most cases that come into your practice. Or try the procedure pack. It comes with 6 files per package. An 8, a 10, and a 15K file. Beautiful for creating the glide path. And then a green, a yellow, and a red. And how about this? You like carriers? Well, there's carriers that match the final file size that you use in the TF adaptive sequence. Matching paper points and matching gutta percha. Once again, the ML1 and the ML2 are the file sizes that I use the most, and the ML2 gutta percha cone is what I use most for my warm vertical condensation technique. So let's review. The TF adaptive sequence. Innovative, intuitive, there's nothing quite like it on the market. When we look at the advantages of it, well, it's easy. It's simple. It's so simple that your assistants will be so happy that you've got this. Green means go, yellow means continue or stop, and red means stop. There's a limited number of files, anywhere from 2 to 3 TF adaptive and 1 to 3 manual stainless steel files to establish and maintain patency and to get to our working length. The unique motion of adaptive motion technology is safer, and it's always safety first. And you get better cleaning. You don't get the suck down. You don't get the extrusion that you get in other file systems that are pure reciprocation. Safer enlargement with smaller TF in complex cases. I love using my SM series in the mesial buccal root of maxillary molars, especially in those cases that have sharp curvatures, because I want to make sure that I keep that preparation as conservative as possible, but yet I want to be able to produce the shape that I want in order to clean it out properly and then use my endovac at the very end to provide debridement and microbial decontamination. It's been a great evening. Hopefully I've given you a good overview of this breakthrough shaping technique. I want to thank Drew Austin for his help in preparing this presentation and Viva Learning for their unparalleled expertise. At this point, what I'm going to do is I'm going to open up the forum to some questions. If you have any questions, please let me know. Here's the first question. What is your irrigant protocol? Well, my irrigant protocol, as I mentioned throughout the presentation, is using the endovac. I believe in using the endovac. I've been using it for 3 years because finally there's a way to safely deliver full strength sodium hypochlorite to the apical terminus safely in abundant quantities. And we know when tissue undergoes hydrolysis, it absorbs the sodium hypochlorite very quickly, and ammonium and carbon dioxide are given off, and all you've got left is water. So what better way to deliver fresh hypochlorite than the endovac to the apical terminus? I do 3 microcycles, one with sodium hypochlorite to remove the fine debris created during instrumentation and to remove the organic tissue in the smear layer. I follow that with a irrigant of EDTA. I like to use Smear Clear. Smear Clear is a 17% aqueous EDTA solution that contains an antibacterial agent called cetrimide. It also acts as a surfactant, so it lowers the surface tension of the solution on the wall of the root canal. It also removes the inorganic component of the smear layer. And my final microcycle is the same as the first. I use my sodium hypochlorite full strength. Now, because I've removed the smear layer, that final rinse of sodium hypochlorite can intimately make contact with the root canal wall, get into lateral canals, accessory canals, dentinal tubules, and remove any microbiota and tissue that's left behind. What other questions do we have here? The questions are piling up. Let me see here. Do I use ultrasonic tips at the end of my root canal preparation? You know, I don't. But you can. There's nothing that says that you can't. And certainly ultrasonic has its benefits with the final irrigation protocol. But if you review the science and the studies with the endovac, and when you see all the studies that have come out by Tay and Pashley and Mitchell and Baumgartner, and you see that 100% of the tissue in isthmuses is removed, and you get 100% removal of bacteria, and that's a bold statement. Do we need to increase our armamentarium for final irrigation? What else do we have here? What is your breakage of TF adaptive in your practice? Okay, get ready for this. I haven't broken one TF adaptive file to date. Because that adaptive motion technology kicks in, and when there's increased force or increased engagement on that file, it goes into reciprocation and increases the cyclic fatigue resistance. Now, I don't want to fool myself. I have unwound files, but you know what? I'd rather unwind a file and have that opportunity to throw that file away. What other questions do we have here? Let me see here. What sealer do you use in your clinical cases? Well, there's many sealers. The sealers that I use Kerr Pulp Canal Sealer, extend working time, and I find it works really, really well. I've been using it for years. I've been an endodontist now for almost 30 years, and I find it works excellently. Or you may want to try one of those new MTA sealers like Fill Apex. Also excellent. It's bioactive. Brings the same formulation and then some as the original MTA formulation. Different strokes for different folks. Greetings from Peru. Greetings from Dr. Glassman in Toronto. Thank you very much. Now we're getting statements. We've got testimonials coming through. It's a great motor. I love it. I'm in love with this system. I'm just reading through these presentations now and these questions. Most of them are thank yous. Not a lot of questions other than the ones that I mentioned earlier before. I'll scroll back up again. Am I on Twitter? Actually, I am. Follow me on Twitter. Dr. G007. Licensed to drill. Alright, I got another question. I used one pack for 5 molars and it never broke. Well, there you go. The proof is in the pudding. So really no question, but a lot of testimonials from a lot of doctors who love it. How many times do I use the files in a tooth? Well, manufacturer recommendation is to use the file one patient use only and then toss it out. That's a manufacturer recommendation, and that's what we do in our practice. We use it once and then we throw it out. But, again, depending where you live, depending on the economy, will depend on how often you use those files. All right. How many cases have I done with no breakage? Well, I've been using the TF Adaptive. I helped do some of the clinical testing. I've been using it for a good 18 months to 2 years, different ways, and I haven't broken a file yet. And I'm just going to knock on wood here because hopefully I don't break one tomorrow. But I know I have the confidence when I go into a case with a 23 millimeter TF file, I'm coming out with a 23 millimeter file. All right, well, there's no more questions that are coming in. And I just want to remind you, we have 2 more webinars coming up. One on irrigation, which is going to be pretty exciting, on October 16th, and another one on obturation filling on November the 5th. My name is Dr. Gary Glassman, and I want to finish off with the fact that I believe in this system, as you can tell by my enthusiasm. So in closing, let me say, when the going gets tough, and it always does when you're doing root canal treatment, just adapt to the situation, and happiness will follow you to the apex. Good night.